in quarantine from the residence. You see those pictures of him working from home essentially. Still, he is a 79-year-old man. That means even though he is vaccinated and twice boosted, he is in a high risk category, high risk group for severe illness. To talk more about this, we're joined by Yasmin Abutaleb, national reporter for the Washington Post. Yasmin, as soon as I heard the president had COVID, I was like, please, someone call Yasmin. We need her on the show. So I'm just going to let you have it. Talk to us a little bit about how the president's feeling, what we know about sort of the latest about his condition, but also sort of what have you been hearing from your sources, health sources, about the way forward for him?
So it seems like, fortunately, the president is doing pretty well and seems to have a mild case of COVID. His doctor has put out two letters. The White House press secretary, Karine Jean-Pierre, and the White House coronavirus response coordinator, Ashish Jha, have done two pretty extensive briefings about how he's doing and his symptoms. So far, he seems to have a cough, a runny nose, some fatigue. His temperature went up a little bit, but now seems to be normal. And importantly, his oxygen, his heart rate, are all normal. And so, in speaking with doctors, they said the thing you would look for with someone like the president, who is 79, or really anyone who develops COVID, is whether they start developing shortness of breath. It doesn't seem that's happened to the president, and the White House has gone to pretty extensive lengths to show that he's fine and he's working and he's continuing to work through his infection. He had a bit of a hoarse voice today when he appeared for a public event, but otherwise, I think it's not really that surprising that he would have gotten COVID, especially given his travel schedule recently, the number of public events he's done. He's a very kind of glad-handing politician, lots of backslaps and hugging, and so the White House had been preparing for this for a matter of months.
And Yasmin, I want to ask you something else, which is that as he, of course, is the most powerful man in America, you could say, someone who's very protected. He is joining millions of other Americans who now have COVID. I wonder if you could talk a little bit more about the overall threat to the country, and especially what that means for the least among us, the most vulnerable, because that continues, at least based on my reading, to be people of color, poor people, people who can't work from home.
Yeah, absolutely. I mean, that's a great point, Yamish. I mean, the president is the most protected person in the country. And, the White House had pretty extensive safety protocols in place to protect him, which included anyone who met with him indoors had to mask, very regular testing. And then, of course, they caught his infection early. So he got access to the antiviral Paxlovid early, which definitely helps. And I think it highlights BA.5 has taken over the country. The reported cases are at a little over 100,000, but experts think it's up to 10 times that, a million or more cases a day, just given how rampantly it's spreading right now. This is the most contagious and transmissible variant that we've seen. And I think the fact that the president, with all the protections he has in place, is still getting COVID just reflects the challenge that we're all facing right now. Most people have had it at this point. I think about 70% of the country has had a COVID infection at this point. The majority of the country is vaccinated, and still this variant has shown a remarkable ability to escape immunity that's afforded by vaccinations or previous infection. And so I think it's just a reflection of how difficult it is for the country to get a handle on the virus, 2.5 years in now. And like you said, the White House has tried to use his infection to say, look, we want everyone to have access to the tools the president has access to that have kept his case mild. Boosters, they're free and available, Paxlovid. But the reality is, in a lot of communities, including communities of color and poorer communities, it's really not that easy to get access to these tools, especially the antivirals.
Such a good point. And Hallie, in the minute that we have left here, I want to come to you. There's this new polling week. You put it up for people. The most recent PBS NewsHour Marist NPR poll shows that President Biden's approval rating has been at his lowest since his presidency. It's at its lowest since his presidency. Obviously, the president wants to be out on the road. Hallie wanted to be talking about his agenda, but now he's stuck indoors. How might this just impact sort of politically where he wants to be?
The White House hopes very little, Yamish, because they have been talking now for weeks about the idea that once we hit this point of the summer, once he gets through these overseas trips, he'd be out on the road, he'd be hustling ahead of the midterms, right? I mean, that was something that was previewed for a long time. So to have the president sort of isolated here in the White House, they are trying to do as much as they can to show he's still working. They released photos. They're talking all the time about the calls he's making. They're trying, they say, to be transparent. I think that's a question. I think that's something that I know a lot of reporters will be staying on top of to make sure they're getting information from the White House in a timely way. But this is not, listen, it is the summer, right? This isn't September, this isn't October. So it's not like the window is closing. I think we often see that Americans' engagement, especially with the midterms, picks up after Labor Day, for example. And so I think that the White House is going to be eager to get the president on the road, but they also understand that they want to make sure they're following to the T every CDC guideline because they got to not just talk the talk, but walk the walk here as it relates to how the president is going to handle this. You've seen Dr. Biden, for example, staying in Wilmington, or staying in Delaware, I should say, out of the White House, out of the way of the president. They're really trying to be modeling here some behavior
Yeah.
that they want to see the rest of Americans take.
Yeah, and Dan, in the last 30 seconds, it's a lot different thinking about what Hallie is talking about, sort of the protocols that the Biden administration is taking versus what we saw under the Trump administration. Different times because, of course, there was no vaccines. But just talk a bit about that.
Well, I think that's the major difference we see. When President Trump got COVID, there were no vaccinations, and he was in quite bad shape, as we later learned. The White House is trying to use this, in a sense, as a teaching moment, that we have these tools available, and we ought to begin to try to use them, and those who have not taken advantage ought to do so.
Well, I will say I hope that President Biden has a safe and quick recovery. I know so many people that have dealt with COVID-19, so I hope that he feels better.